spray off it. Laugh at that. Alright, so again, now we're going to move on to the next examination. This time around, we're doing a diabetic examination of a diabetic patient, precisely looking for diabetic neuropathy. Alright, an examination of diabetic foot as well. So, hi, my name is Dr. Courage. I've been asked to examine your legs. Is that okay? What's your name? Alright, so because of my examination, alright, I'll be having a look at you. I'll probably also be touching around your legs, alright, and asking you to do certain movements as well. Alright, if you feel any discomfort, please let me know as well. Alright, so I'd like to start my examination by, first of all, I've gotten consent from the patient. I'd like to start my examination by taking a step back and doing a general examination. General examination, patient is lying comfortable at rest with no obvious cardiorespiratory distress and no physical distress. I'd like to request for the vitals, and I've been told the vitals are stable. The next thing I want to do is, because this is a diabetic exam, is also request for what the blood sugar is, the random blood sugar. Alright, and in this case, I'm being told that the blood sugar is 500 milligrams per dl, which is elevated. Alright, so now I want to move on by doing dry inspection of the patient, just looking at the patient, and I want to check the hands of the patient. Can you see hands like this? So looking at the hands, so I'm just looking for any finger prick mark, which to see if the patient have recently used the glucometer to check for blood sugar. I don't see any right there. Alright. Normally, the patient would have been draped with the legs exposed, and I want to do the draping, triangular draping, where the draping is done in this way and this part of the legs are exposed. So we'll pretend the legs are exposed right now. So looking at the legs, I'm looking for any signs of peripheral arterial disease. Looking at the leg to see if it's shiny, if there's any hair loss. I would also be checking the legs to see if there's any visible ulcers around the areas of the medial or lateral malleolus. I also want to look at the sole of the feet to see if there's any kind of ulcers here as well. If I find any ulcers on the sole of the feet, those will be neuropathic or pressure ulcers, and any ulcers on the side of the legs or above but not on the sole will be arterial or venous ulcers. This patient has no ulcer. Patient has no ulcer at the moment. Alright, so moving on, still on inspection, I want to look at the ankle joint to see if there's any ankle deformity, which is what we call Charcot joint, and I don't see any, which also results from neuropathy and mechanical trauma. I don't see any. Still on inspection. I don't see any scar, I don't see any redness, I do not see any atrophy of the muscles of the legs, and I do not appreciate any bone deformity, no Charcot joint. Moving on to palpation, obviously I want to check for the skin of the legs. I'm just going to touch it, right? Feeling for the temperature, alright? The peripheral limbs, normal temperature. It's not cold to touch, alright? It's not cold to touch, it's just normal temperature. Now I want to also just check the capillary rate flow of the legs, alright? Right, and it's less than 3 seconds. So the next thing I want to do is to just check for pulsations. I want to start with femoral pulsation. So just ideally femoral pulsation with permission from the patient, you check around here, alright? If you feel the femoral pulsation, you still have to continue. So I can feel the femoral pulsation here bilaterally. You do it on both legs, so you do like this, alright? And then you check for popliteal. So just check here. So just checking behind, alright? And popliteal pulsation is +2, which means it's fully felt. Another leg +2 as well. Then you move on, alright, and you want to check for posterior tibia, which is just behind the medial malleolus. Alright, and check both sides, and it's also +2. And then dorsalis pedis, which is just right here, and I can feel that, and it's +2, which means that the circulation on the lower limbs is intact and there's no occlusion from any atherosclerosis. Alright, so pulsations are intact. But still, I want to also move on and do range of motion. So just to check for movement, so just bring your ankles, bring your heel towards your bottom, your butt, please. Butt is straight, both legs. Alright. So now I'm just going to hold the leg, alright. So just try to kick this out. I won't let you kick out, I try to pull it in. Alright, good power. Same thing here, try to kick out. Try to kick out and try to pull in. Okay. Right then, put your legs down. Alright, same thing. Cuff your ankles backward like this. But I'm going to try to push it down. Don't let me push it down. Alright, now push on me. Alright, I want to push down. Don't let me push it down. Now press on my hand. Alright, so power is 5/5 at the level of the knee and at the level of the ankle. Alright, we're just going to skip for hip flexion extension. I'll skip that for now. Next thing to do is to check for reflex. Well, I assume this is the reflex hammer. I'm just going to lift your legs up like this, alright? So just relax it, right? No, just leave it flopping. Right, then I'll just check for the reflex, and I'll check, and there will be slight movement here, and I'll also check for the knee reflex, and I'll get that movement as well, which means the deep tendon reflex at the knee is also +2. I would like to also check for ankle reflex, and for me to do that, I will dorsiflex the ankle, dorsiflexion, and eversion. Right, and I'll tap right here and check for any contraction in the calf. And I'll repeat the same thing again, dorsiflex and eversion, and I'll tap here, I'll check for contraction at the calf. Alright, and we'll assume that the ankle reflex and the knee reflex are both normal right now. So with reflexes normal and power 5/5, I'll move on to check for sensation. So sensation we'll do with fine touch and pinprick. For the sake of this exam, we'll just stick with fine touch, using a cotton wool, putting it, and then explain to the patient. I'm going to put touching your legs, different area with this cotton wool. This is how it feels. Can you feel that? Alright, so I'm going to ask you to close your eyes and let me know if you can feel it and it feels the same. Alright, so close your eyes. Alright, so we'll start, normally we'll start distally and go upward. Alright, so do you feel that?
Yeah.
Did you feel that?
Yeah.
Feel the same?
Yeah.
Feel that?
Yeah.
Okay, but for the sake of this exam, alright, you will say no and I'll tell you to say yes. Did you feel that?
Yeah.
What do you feel that? You say no.
No.
See, I'll tell you when to say yes. Do you feel that?
No.
You feel that?
No.
And this?
No.
Right, so move on to the lateral legs. Do you feel that?
No.
You feel that?
No.
Okay, do you feel that?
No.
You feel that?
No.
This?
No.
This?
No.
When we get to the knee, you can say yes. You feel this?
Yes.
And this?
Yes.
So the patient had loss of sensation to fine touch, alright, extending from the bilateral feet up to the level of the knee, which is a stocking distribution, loss of sensation to fine touch. Alright, so we'll repeat the same procedure, alright, using the pin, which is the pinprick sensation. For the sake of this examination, we're assuming we had the same finding. She had loss of sensation, the pinprick, in a stocking-like distribution. Moving on, what will be the tuning fork to check for vibration? To check for vibration, we'll pretend this is our tuning fork. Hit it against the elbows, it's vibrating. This is a tuning fork. This is how it's supposed to feel. You'll feel it shaking in your chest. Can you feel that? Tell me when it stops, and I'll do like this. So stop. So I'm going to do that on your legs. I want you to close your eyes and tell me when you can feel it. Right? Remember, you keep saying no, so I tell you to say yes. So we'll do it. I will start with the bony prominence of the big toe. You feel that?
No.
No. Alright. Alright. We'll move to the next prominence, which is the lateral malleolus. You feel that?
No.
Alright. And we'll move to the next prominence, which is the tibial tuberosity. You feel that?
No.
And now finally to the knee. Like you say yes.
Yeah.
Yeah, okay. Now repeat the same thing in the other leg. You feel that?
No.
Lateral malleolus. You feel that?
No.
And then tibial tuberosity. You feel that?
No.
And then to the patella of the knee.
Yes.
So patient, bilaterally, this patient also has loss of vibration sensation in a stocking-like distribution, and vibration is intact from the knee upwards. Alright, and the last test we'll do, one of the last tests we'll do is also joint position. We'll check for proprioception. So this, right, stabilizing the one joint above. Alright, this is down and this is up. Alright, so I'm gonna move your legs, your toe up or down. You tell me what direction it is with your eyes closed. So close your eyes for me, please. Alright, so
Down.
Up. Okay.
Down. Up.
Alright, so in this case, patient has intact joint position. Alright, you don't necessarily have to have loss of every sensory modality. Some may be intact depending on the severity of the disease. Alright, so that's joint position. The next thing we're going to do now is to do the ankle brachial index. The essence of the ankle brachial index is to check for the degree of perfusion of blood through the arterial vessels of the lower limb. In a patient with diabetes, which is a risk for atherosclerosis and atherosclerosis of the peripheral arteries in the legs, which is peripheral arterial disease, in diabetic patients, uncontrolled diabetic, there could be atherosclerosis that blocks blood flow down the leg. So the way to check that is to do the ankle brachial index. If it's less than 0.9, it suggests that the patient has peripheral arterial disease. If it's greater than 0.9, then it means there's good perfusion. The way to calculate the ankle brachial index is to measure the brachial blood pressure, alright, the systolic part, and also to measure the ankle blood pressure. But the ankle blood pressure, you measure it by tying the cuff, by tying the cuff of the blood pressure, the cuff of the blood pressure around the cuff, alright. And then you take note of the systolic in the brachial, divided by systolic that you got here, and that should give you the ratio, which a normal ratio is above 0.9. and the pathological ratio is less than 0.9. In this case, we'll assume it's normal. The next thing to do now is to perform the Burger test. Just keep your legs straight, both legs, and lift it up, please.